Hi, this is Jamie Davis, the Pod Medic. I'm here with Bobby Brown, Director of Systems Support for Nova Scotia EMS. We're at the IRCP conference. That's the International Roundtable for Community Paramedicine. And Bobby's here talking about some of the initiatives they're doing in community paramedicine in Nova Scotia and really helping to educate the rest of us about what's going on there. So Bobby, I want to welcome you to the MedicCast and to the videos we're helping to produce here for the IRCP conference.
Happy to be here.
So tell me a little bit about the background. How long have you been involved in this initiative? You were pretty much there close to the beginning, is that correct?
Yep, pretty much from the beginning. We started in about 2002. And we've had one program ongoing since then on two little islands off the coast of Nova Scotia called Long and Briar, population of about 1,200 folks. So we have a paramedic base that is located at a community clinic, and we partner and collaborate with a nurse practitioner in that particular program.
And as far as the IRCP goes, they held one of their initial meetings, I guess their first meeting in Nova Scotia.
Correct.
And you were able to bring that initiative and start doing things with them right away and start bringing that community paramedicine model to the rest of the world. What is the thing that you're most excited about with some of the initiatives you're seeing developing in other places now?
Well, again, it's about learning from one another. And while we all have very good programs in our own nations, and healthcare is a challenge regardless of where you are, the opportunity to learn what has worked and what hasn't worked in certain areas of the province or certain areas of the world, really, so that we can build together and build a strong foundation for what is really truly a new model of healthcare. Although paramedics have been around for some time now, since the 50s, this new evolution of healthcare for paramedics is new to the healthcare system. So the more we can collaborate and communicate, the better off we are.
What's next for, I heard you discussing, talking about a national paramedic representative at the national level in Canada. Is that an initiative you're working on right now?
Absolutely. The EMS Chiefs of Canada, which I'm fortunate enough to be part of their board and executive. One of our primary initiatives this year is to hopefully to set up an office for the chief paramedic in Canada, who would represent national issues and bring that national voice, if you will, to Parliament. And also would act as a resource to parliamentarians as well in terms of what our role is and what our future roles could be.
So really assisting in developing policy for EMS for the entire nation.
Exactly. EMS as well as future in general healthcare as well.
And it's true, because we think about EMS. We talked about boxes this morning.
Exactly.
Denny Behrens was talking about getting outside of the box.
Yes.
And you're right. EMS, we think about it as this emergency care resource, but actually getting outside of that box really means focusing on the fact that EMS is part of the healthcare system and really a vital part of that.
It most certainly is. And we have a very good foundation in many parts of the world, in particular with the U.S. and Canada and Australia. And we can build on that. And we're, as I like to say, we're a paid healthcare service now. Why not utilize us more, particularly in rural areas where the call volume is not necessarily high enough to sustain paramedics on a daily basis. They have a wealth of knowledge and talent that they can provide to the citizens of those communities. So why not? It makes good sense.
Well, Bobby, thanks a lot for being part of this program, helping out with the MedicCast and helping out with IRCP.
Well, thank you so much for having me on. I appreciate it.